Welcome to the Education Outreach and Access Connecting Underserved Communities workshop. My name is Sharon Bertelsen. I am a communications attorney with the law firm of Ballard, Spahr, and I will be your moderator for this workshop. We will explore what it means to be in an underserved community with respect to broadband access and how to improve access to vulnerable and disadvantaged population groups, such as low income, unemployed, seniors, minorities, children, and people with disabilities, where broadband technology has traditionally been underutilized. And there are two components to the equation here. One, getting broadband deployed, and two, getting people to adopt the services. We have an excellent group of panelists today. Mel Walker is a Senior Director of Product Management at Sorenson Communications, the leading provider of video relay services to deaf, hard of hearing, and speech disabled individuals. And not just here in Utah, in the entire country, and they're headquartered here in Salt Lake. Mel will discuss how broadband is improving communications for these communities. Then we have Deb LaMarche, Associate Director for the Utah Telehealth Network. She will discuss the impact of broadband in rural underserved areas and the direction of healthcare moving forward. She will also discuss how broadband is being used to make more healthcare services available to tribal communities and those in rural areas who cannot afford to travel long distances to visit medical specialists. And she's also going to tell us about a newly connected health center on one of the reservations here in Utah. Emery Polelonema is a regional planner for the Six County Association of Governments. He recently completed a tribal tour in Utah, and he will share strategies on ways to better connect with tribal leaders to collaborate and cooperate on broadband-related issues. And Jilenne Gunther is an author and attorney with the Utah Division of Aging and Adult Services. She is going to discuss a recent study of seniors, many of whom are low-income residents in Utah, and part of the study focused on how seniors are using the internet. Each of the panelists will make a brief opening statement just to get us started, and then we will have a question and discussion format. Mel, would you like to start?
Sure.
Okay, great.
Everybody hear me with this? Yeah, good. So I don't know how many people were able to attend the afternoon session about cybersecurity, but he left us with a lot of fear, and I think what I'm going to do is start off with some hope and share with you guys how broadband has impacted the community I work with, which is the deaf and the hard of hearing, in a very positive way. Anyone familiar with TTY? Heard of TTY before? Okay, so most of you are familiar with the TTY. TTY is like Morse code compared to the video relay services that we're able to offer today. And what I mean by that is because of it's a good analogy because of the wiring that you had to use during Morse code, when the radios were slow and the communication was slow and lots of latency. The bandwidth that's happened today has allowed us to have very improve the communications to the point that deaf and hard of hearing Americans that use ASL, or American Sign Language, as their native language can finally use that in all their communications. I'm just going to share with you, because it's one thing to say to kind of describe what VRS is, but I've got a good video done by a great our great PR department, marketing department, that really describes what the video relay service is like. So I'm going to just play that video now, and then talk a little bit more after it and hand some time over. So,
Got it.
I'm too tall to use the stairs.
To place a video relay service, VRS call, a deaf caller uses a Sorenson video phone, which produces high-quality images and transmits facial expressions and quick hand motions, all essential when communicating in American Sign Language. Using a customized remote, a deaf caller can select the pan, tilt, zoom feature to ensure his picture is centered and focused. Next, the deaf caller enters the phone number of the hearing person he wishes to call. Then he selects the SVRS button. The call is sent to a video relay interpreter at one of Sorenson's many interpreting centers located across the nation. The video relay interpreter answers the incoming video phone call and signs. The interpreter then calls the hearing person on behalf of the deaf individual. The hearing caller answers a cell or standard telephone.
Hello?
And the interpreter begins voicing the deaf caller's signed message, thus relaying the call.
Hi, this is Sorenson Video Relay Service, Interpreter 100. I have a call for Jake.
This is Jake.
Hi, Jake. I'll go ahead and begin interpreting. Hi, Jake. It's me, Uncle Jimmy.
Hey, Uncle Jimmy.
Hey there. Say, I just got some tickets for the game tonight, and I was wondering if you wanted to come along.
Hey, Jake, don't forget to call Uncle Jimmy, okay?
Okay.
Through Sorenson VRS, hearing callers can initiate calls to deaf individuals. The hearing caller uses a cell or standard phone to dial a deaf individual by simply calling a local, 10-digit, or direct VP number. A direct VP number is a toll-free number. The call connects to a video relay interpreter and then to the deaf individual he is calling. The interpreter interprets the call and relays the information.
Hello, thank you for calling Sorenson Video Relay Service. This is Interpreter 100. I'll go ahead and connect your call.
The flashing of the video phone's light ring indicates an incoming call, and because different light patterns can be assigned to different contacts, is a visual caller ID. The deaf caller uses the video phone remote to pick up the call. The interpreter then begins signing what the hearing caller is saying.
Hello, this is Jimmy.
Hey, Uncle Jimmy, it's Jake.
Oh, Jake, it's great to hear from you. So, what did your mom say? Did she say yes?
Yeah, I talked to her and she said it was totally cool that I go to the game with you.
For more information on Sorenson Video Relay Service, visit www.sorensonvrs.com.
So that's just a quick overview of what we do. And this service, it wasn't made possible until we had the bandwidth to do it and the broadband. Today, that video was actually made several years ago. When I started with the company in 2005, these video phones were just rolling out. We're actually on our second generation video phones now. And I think if they updated the video, you would see videos of deaf people calling other deaf people using a cell phone now as well. So we have that technology. But the central part to it is the amount of video we get through there. So I think earlier this morning, I'm going to harken back to Dr. Reichert's speech. He gave us 3 things about big data, low latency, and this virtualization. And for my specific audience doing video over the internet, I need all 3 of these things to increase. We have big data happening because we have a lot of video. Today, even as far as video has come, there's a lot of limitations in the size of the video, in the resolution that you can receive, because we need that more bandwidth in order to increase that. And if you think about it in terms of the way I think about it today, we're kind of in the era for the deaf of when comparing to when a hearing person got a cell phone. And we were so happy just to have the service. We didn't care that it dropped calls and it didn't do everything that we wanted. Well, the deaf are kind of in this stage now. The technology is great. We don't drop calls that often, but the resolution can break up. Packets can get lost, and a lot of this has to do with the infrastructure and the lower bandwidth. Obviously, we increase bandwidth, we have lower latency, we're going to be able to deliver even higher video resolutions to our customers, and they're going to have even a greater experience going forward on this. So that's just what we do. For this topic as well, one thing I will stress, if you look at Sorenson, we are the leader in the nation for doing video relay services. We've had great help from the FCC, from government entities, but I would say that there's three things we always tout as to why we are successful as a company in helping out this group of individuals. And those three things have been the technology with the video phone. The second area has been our outreach. We've had a tremendous amount of outreach efforts by other deaf people within the community with the deaf. It's a very small knit group, and the more people that we engage with, the faster this gets out there. So outreach has been huge for us to be successful as a company. And I think that's about it for me, and I'll turn the time over to Deb.
Wait, Mel. Yeah, we need PowerPoint. There it is.
Sharon, do you want me to come down there?
This one?
Doesn't matter, whatever.
I'll come down.
Broadband Summit. Thanks.
Perfect. Great. Hi, I'm Deb LaMarche with the Utah Telehealth Network. I'll just start by saying that what our mission is, which is to expand access to healthcare services and resources through the innovative use of technology. Our primary area is Utah, but healthcare doesn't stop at borders, so we really look at the whole Intermountain West. Just this picture, that is the Utah Navajo Health System has a clinic at Navajo Mountain, which is in Utah. That clinic's in a double-wide trailer. They have incredibly sophisticated tools inside. That tower is, I don't know how many feet tall, really tall. It connects to a 100 meg microwave service that gets relayed. And I'll talk about that a little bit more in a sec, but that clinic is 181 miles from the nearest hospital they would use in Utah, which was in Blanding, and it's almost 500 miles to Salt Lake City. And so it's really important that they have access. And actually, to get to Navajo Mountain, if any of you have ever been there, you go on a dirt road. I mean, you have to go down to Arizona and travel on a dirt road up to it. So it's about as isolated as we can get. So it's a nice example of expanding access. So our network connects hospitals, clinics, health departments, and behavioral health facilities. It's open to any Utah healthcare provider. The idea behind the network is for particularly rural healthcare facilities or those that are isolated or serve the underserved, that they should only need one connection into a network to access whoever they need. So when we say it's open, it's we have competitors on the network. They're not related sites. It's so they can get to wherever they need to go. We were able to, a few years ago, probably most of you are familiar with E-Rate. Are you probably? Through schools and libraries. Well, there's a comparable program on the healthcare side. The Rural Healthcare Pilot Program launched 4 or 5 years. They had one for T1 lines, which were pretty fast back in the day in the 90s, but now is very, very slow. So they had a pilot program. We were able to build out a nice network using this infrastructure, using those dollars. And so we now have a statewide metro optical Ethernet network. It all runs over fiber and or microwave on the Navajo Reservation and a few other locations. It makes more sense to use the microwave. The sites in the network connect at anywhere between something as low as 5 megabits per second up to 100 or more. It's a scalable network so that they can get more, but they're paying for it, so they want to get something that's sized for what they can afford. There's only a couple of 5 meg sites, and most of those are maybe an office that's open 1 day a week with one provider or something that don't have a need for a lot. But most are in the 50 to 100 meg range. We, as a network, we offer the network management and security services. We act as technical extenders to all of these healthcare facilities because they often don't have anyone, or if they have a technical person, they have to do everything. They have to support all the applications, the servers, the desktop, the network, and so we serve that function. So just a little bit on what happens over the network, because that's really what this is all about. So we do patient care, and that can take a lot of forms. It can include direct patient care over video conferencing. It can include care coordination. It can include remote patient monitoring of patient data. We have public health applications. We do training and education of health professionals. And I'm just going to use a couple of examples to paint the picture. So one of our applications that's made a real difference that runs over the network is telestroke. And this is something that's offered by the University of Utah to rural hospitals and clinics, and actually even some urban hospitals and clinics. If a person has a stroke, there is a 3-hour window that if you've had the right type of stroke, that there is medication that can help mitigate the impact of the stroke. I'm not a clinician, but probably most of you aren't either, so I'm going to give you the lay version of how this works, and just take it with a grain of salt. Anyway, there's 2 types of strokes. One is a blood clot. This medication busts up the clot. The other type of stroke is a bleed. If you give clot-busting medication to a patient with a bleed, you are you could. So anyway, this program started, I don't know, maybe half a dozen years ago. The better bandwidth we have, the better video conferencing equipment, like Mel was talking about, it's really made a difference. But patients now can be brought into an ER in a rural healthcare facility and have a University of Utah specially trained stroke neurologist helping diagnose and treat them. And there are patients that have walked out the door the next day after suffering a stroke with no negative impacts of the stroke. Now, stroke's complicated, so that's not true every time, but there are an amazing number of success stories, and there's no time to transport. If you are in Moab and realize, they decide you're having a stroke, there isn't time to arrange the transport and everything, because the clock starts ticking when you have the stroke, not when you get to the hospital. So it's an example. Another one is Project ECHO, and that stands for Extending Community Health Outcomes. It's not a technology per se. But that's a case where primary care providers in rural locations get to work with specialists and a whole specialty multidisciplinary team, pharmacists, mental health providers, and whatnot, to treat complex diseases. So hepatitis C, there are more than 42,000 patients in Utah that have hepatitis C. It's curable, but it's a very difficult and complex disease to treat. There's no way all those patients can travel to a specialist to be seen because you need a lot of constant care. So what Project ECHO does is it allows the primary care providers to get together with the specialist on video conference, multi-point video conference, present cases, learn from the specialist, but learn from each other, and become the specialist in that area in their rural community so that they get referrals for those types of patients. So ECHOs are being launched in a lot of different disease states. Those are just a couple examples. I'm going to give one more. You did see that first site was one of the Utah Navajo Health System sites. They have 4 locations. They have a hospital in Blanding, but they have a clinic in Blanding, another one in Montezuma Creek, and 2 on the reservation, Navajo Reservation, Monument Valley, and Navajo Mountain. They have the most amazing healthcare system. They do radiology like you do in any urban facility, but they don't have an on-site radiologist, so those images get sent. They have telepharmacy, which allows them to really manage the pharmaceuticals that they're giving out. It does inventory, but it also helps make sure they don't do drug interactions and all those other things, and it secures the system. They have video conferencing. They are able to, do meetings and collaborate with care coordination. But one of the other things that they do is on the reservation, there's not a lot of bandwidth. And even one of the local IT people in Monument Valley who grew up there, he said at home he's got DirecTV with NFL Sunday Ticket. He can watch any football game going on the weekends. But they have not great bandwidth in their homes on the reservation, at least now. Sounds like we might be hearing about things that are improving. So what they did was the Utah Navajo Health System put 100 meg connections in all these clinics, and they've parceled off a lot for the patients to use as guest wireless, which every healthcare facility does now. So you go into the waiting room there, and every person in the waiting room's got their smartphone and or tablet, and they're working away like crazy while they're waiting for their appointment. And the wireless actually sits outside in the parking lot, so people in the community come and use it nights and weekends so that they can do the business they need to do. So it's not direct patient care, but it's a service that the community really benefits from. So that's kind of what, in a nutshell, what we do, and look forward to the discussion. Emery?
Sure.
Can you hear me? Just gonna sit down. My name's Emery Polelonema. I'm from Richfield, Utah. Work for 6 County Association of Governments. We cover an area in the middle of Utah, central Utah, and it's about 17,000 acres. We have a population of about 75,000 people right now. I think it increased from the 2010 census. This is, I think, 2012 numbers. 49 mayors who we work for. We've been concentrating on our own efforts in doing the services, community development, economic development, and now this broadband planning project. And we have 2 bands of the Paiute Indian tribe of Utah in our vicinity. One band is Kanash. They're domiciled in Millett County. The other one is Koshuram. They're in Sevier County. And then in Juab County, we have the Ibapa that comes in from the Nevada side. And they have 45,000 acres of land. The other 2 combined they have about maybe 2,400 acres. So it's small, the 2 that we work with within our jurisdiction. When this broadband project came up, again, we were looking at the goals and the plans, who should be on it, and tribal leaders were listed. And not to, if you've seen this thing, this is a brochure that has, I have 2 AOG reps sitting here. Brian Carver right there, raise your hand. And then Amy Peters from Southeast. And so we know the challenges of reaching out people. We are rural, remote, or wilderness, whatever you want to tag on there. And sometimes our outreach is not there. Hanksville is on the far end of the far eastern end, and then Hinckley Town. And I visited both of those towns. They were far and wide. One was on the east, one was on the west. But when they asked for help, and there's no way really to communicate with them but to go see them. And this broadband, I hope this comes to fruition and we implement it to to optimize our technology. And it was great to see all that stuff in the keynote speaker. But fear, I don't know, that that kind of scared me a little bit. What we do with our communities, they can probably attest to that the elections come and go, and the stalwarts are the clerks of the town halls, okay? They're the ones that we maintain connection with. Now, we go into the tribal areas. The connection is zilch. I've been with the Association of Government since 1986. And so this forum that we took to the 5 nations a couple of weeks ago, that was a long time coming. They are in our backyard, but we don't even know who they are and you know what they represent. And so we started to attend our local bands. And you know, in Utah, we have strict guidelines on the days of the week. And their meetings are held on Sunday afternoons. And so, you know, so we have to, I guess, buck up and just go see them. And the Kanash band, they have a nice clinic. I mean, when you were showing the Navajo. And then they had another one in Richfield. But that one happened to close down. I don't know if it's the resources, sequestration, or what. My topic is outreach. You know, broadband will be a byproduct of how we deal with the Indian nations. And so about 2 years ago, we started talking about maybe going through the reservation, maybe just the Paiute tribe of Utah. But then we decided to dream big, and we visited 5 nations. And you think that was a challenge for me. I mean, it is like they have email, they have telephones, cell phones. I'm not sure what the deal is, but I made many trips down there. I would call, I would leave email, or send email. I would leave messages on their cell phone. And crunch time was coming, and no responses back. Man, I'm good. I had my neck out. We had already rented a big old bus to haul 55 of us down into their neck of the woods. And so I made my last run down there. Oh man, they were so happy to see me. Oh yeah, I'm glad you guys are coming. Well, why didn't you answer your cell phone or write an email back? And so it was really a challenge, and so persistence pays off. The AOG director looked at me that one Monday morning. I said, Russell, I am headed south. Can't you just email or call him up? What do you think I've been doing the past month? And so persistence, you know, I'm glad that you guys are, you know, getting things done working with the Navajo Nation. And what I've learned for myself from this trip is we throw around big words like communication. We throw big words like collaboration. And so when we went down there, all of the tribal members, they were unique in themselves, but they spilled their guts out to us on whatever issues was at the fore, what issue was at the fore, they told us. And I was talking to Heather out there in the hallway, and she said Tonalia and Big Water, and the connection. I think we have a common denominator with Board of Supervisor Lena Fall, and I'm sure we'll get something done with that. And then trust. That's the biggest thing that we need to impart to them, so that we could have a dialogue, not a discussion. Somebody told me that a discussion is a percussion, and you know what that means. And a dialogue is actually listening. We had 40 individuals, elected officials. We had Spencer Eccles and Chris Conaby from the governor's office. They rode on the bus with us. And what we had provided for the attendees, we had Gary Lafferty from the Paiute Indian tribe of Utah. We left Richfield at 9 o'clock to her tribal headquarters. And she enlightened us on who they are, what their challenges are. So we got to know each other, the mayors, the commissioners, Chris Conaby, Spence Eccles. And then we had the State Parks of Utah represented. And then economic developers from our area. So it was a get to know each other's, and to just share whatever we need to do to start the ball rolling. And the lessons that we learned from this trip is that we need to listen and trust was really paramount. And we had one young lady from the Hopi Nation. You know, there's social issues out there, let alone broadband problems. You know, the basic necessities are not even there. And we went to this Monkopi Legacy and Inn, and we had a nice facility like this. That was the number one showcase. The next day, we went out onto the site visit, and that's where we saw where the rubber meets the road. Our guide on the bus for the Hopi, she's the assistant to the vice president of the nation. She doesn't even have running water. We discussed Navajo Mountain, the land issues. As planners, we talk about land issues. Our area, for example, in 6 County, we're about 80, maybe 83% federal land base. Wayne County only has like 3% of private property. And Navajo Mountain, I'm glad you brought that out. The Paiutes, we visited 3 bands of the Paiutes, and all of the 3 bands claimed it. And you know, so I'm glad we met them on different times and so there was, my wife is Navajo, and everybody's down on the Navajos, and she goes, God, man, we must be really bad. And then we had the last tribe that we talked with was the Hopi Nation, and we have, we claim ownership of that land, plus the San Francisco, and so we talked about all kinds of issues. Where's Michael at? Apparently, Mike, is that your name, Mike? Did I get that right? He had worked with the Hopi on the Hopi Telnet system. And so as I walk around here, I'm meeting a lot of different individuals who have different, care, compassion maybe. I think our listening skills were made to the hilt. You know how we on this side we're aggressive. We just talk, and I was really impressed with all our county commissioners and our delegation that we listened to them. We sat out there and we listened. Whatever they had to say, there was an old man, we could hardly hear him, but he told us practically the whole history of the San Juan Paiutes. And there's an invisible nation that I did not know existed. I visited 4 tribes, and I came up here to UVU to this Native American Economic Development Summit. I was talking to the Paiute Indian tribe's chairwoman. Here comes Mae Preston right behind her. She asked, "What about me?" I looked at her and I said, "What about you?" Well, I'm the chairwoman of the San Juan Paiute, so we met with them also. And that was one of the best meetings that we had. And some of the comments that she made to me was, you guys on this side, you guys exploit us. You guys do this, you guys do that. I don't want any part of your activity. It was just handling a snake, and finally we got her settled down, and we met them on the last day. Collaboration. Chatted with Lena Fowler just yesterday, and they're working on broadband. And I drew down, I have a NACOGS, which is a house in Arizona, our counterpart, or northern part, and I have their plan right here. So I think we need to go across state lines, and they were meeting with New Mexico and Arizona, Coconino County, and I don't know who the other constituents were, but they were meeting yesterday. So I think the lessons that we learn is communication should be honest and genuine. That's what we need. And I see that, we do things, and, I think sometimes greed takes over. And trust, I can't stress that enough, is trust. I've been around Utah for a very long time, and I think I'm almost a native in Richfield. But if you have any questions on that, I'd be glad to. And I was invited to go meet in Wendover with with the tribes of Utah. They're having their gathering on November 8th, and I was invited by the Division of Indian Affairs to share what we learned from our forum going down south. Thanks a lot. Maybe I went over my time.
How do I get to my...
The other one. What did you just do? Can you go back to the, no. You're
That's
too
where-
fast. Yeah, and
Sweet.
One
Is this
down.
mic work?
one down.
Okay.
Mhm.
Thanks so much. My name's Jilenne Gunther. I am an attorney and author. I practice elder law in the state of Utah. Thank you so much, Sharon, for inviting me to speak. Since I have the microphone and Sharon doesn't, or she does, I'm going to embarrass Sharon. Not only is she an expert in broadband, but she is our largest volunteer with the Utah Division of Aging and Adult Services. I have a budget of $1,000 a year. And so we refer to Sharon as our angel without wings. I wanted to talk about seniors and whether they're using the internet. Okay? So here's my cell phone. And my father is 72 years old. And these are all the emails I've gotten just from today from my father. My father is using broadband. But what about Utah seniors? My dad lives in New York City. Our seniors are online. The answer is yes. 53% of seniors are using the internet on a regular basis. The other interesting thing is it varies by age. What we're seeing is younger seniors, those between the ages of 60 and 69, and I know that really 60 doesn't really seem like they're a senior. In my mind, they're not, but 69% of seniors between the age of 60 and 69 are using the internet on a daily basis. And as you can see from this chart, even the people that are in their 70s, about half of them are using the internet on a daily basis. The other interesting thing that I wanted to look at in this study, where we really were looking at legal needs, but we wanted also to see where seniors are using the internet, is that seniors are using the internet more in rural areas than they are in metropolitan areas, slightly. It's the micropolitan areas that are not using it at a greater pace. In terms of Utah seniors, I wanted to look at it whether they're using social media, and that's just from my perspective of how do I get legal information out to seniors. What we found was that 69% of seniors are using or have used YouTube. They're using Facebook. They're also text messaging. I also can pull up the text messages that I get on a regular basis from my father as well. They're not using Twitter. I don't use Twitter. So why should seniors be online? Why would someone from the Division of Aging and Adult Services even be interested in this? Well, Deb talked a little bit about this, is the fact of the matter is a lot of seniors want to age in place. They want to stay in their own homes. A lot of people in the rural areas want to stay in their own home and not have to move to a facility. And what broadband allows them to do is to age in place in their own home. And I have to give a shout out to a colleague of mine, AARP, Chris Baker, who does a lot of research on broadband and how broadband can help seniors age in place. A lot of the resources are typically for healthcare or out of the home. But there are things like home health monitoring, where if you're using broadband, you can hook up to the internet and have internet connecting devices, and that's been shown to reduce hospital readmission rates when seniors are using that. The other thing is, and Meg already kind of talked about this, or Deb did, sorry, is that there are two-way conferencing for healthcare professionals. So a senior in their home can have a 10 to 15-minute conversation with a healthcare professional. The other thing that's occurring too is that there are projects going on throughout the United States where if anybody here has had someone in their family have dementia, anybody, or Alzheimer's, it's a really difficult situation to deal with. And one of the projects that includes Broadband is this project. They give the caregiver a laptop to video record some difficult interactions they've had with the person they're caring with dementia. And then that is then sent to a team of healthcare professionals who then look at that and then provide feedback to the caregiver about better ways to handle those difficult situations. The other thing is home automation. It can alert a caregiver about abnormal situations. Sometimes those of you that raise your hand, you know that caregiving is burdensome. But home automation alerting can tell a caregiver or a senior about an abnormal situation, that a stove hasn't been turned off, that a door has been opened in the middle of the night with somebody who has dementia, which is a red flag, as we all know, or that a medicine cabinet's been opened, or there's a lack of movement in the home, which could then signify that maybe the senior's fallen and needs help. It also can help assist those who are visually and cognitively impaired. There's also help for seniors. I didn't talk to you about my mom. The emails I get from my mom are emails from really my father, who's dictating to her. So where does a senior get help? Well, senior centers are a really great place. They do one-on-one computer classes. Senior centers also have classes where they go online to teach seniors about Facebook, genealogy, and then just have other basic computer classes. In St. George, the senior center and seniors in that area, they're using Sonos, and I don't know if some of you are familiar with that, but it's a music speaker system that works on Broadband. And they use it in Zumba classes. And if you don't know what that is, Sharon can tell you afterwards. And also, we're seeing more seniors that have iPads and Kindles because they like the fact that they can increase the font very simply, and that they have access right there and can pull it out really at any time. They're using it at senior centers and they're carrying it around. So we're seeing a lot more usage there. Yes.
Well, as all of you have heard throughout the day and the workshops that we've all attended, and many of you know from your professional lives and your personal experiences that technology can really revolutionize communications, healthcare, energy, public safety, economic development. But I think we also realize that we're not there yet. And we have little work to do. And my question, I wanted to ask the audience if you all have any questions, but I'm curious to know from people on the panel, what do you see as the barriers in your special areas as far as where we are today? Deb, perfect example, in light of healthcare, in light of the reform, given the direction that we're going, how do you see broadband improving healthcare delivery?
Well, one of the challenges that we still have, so most healthcare facilities now have most healthcare facilities, even in rural areas, have pretty good broadband. Healthcare was one of the last industries to really go electronic. But finally, most healthcare providers use electronic medical records, management systems, all of that has gone electronic. They've become dependent on it. So one of the concerns, and now there's the ability, even though most electronic medical records don't talk to other ones. There's a lot of work happening with healthcare reform to get those electronic medical records speaking to each other. So if you are in one place and you end up in an emergency room, maybe you're even unconscious, they should be able to access key pertinent information, allergies, whatnot. All of that means these systems have to stay up all the time. And one of the big concerns we have is there are some paths in the state where if a backhoe does the wrong thing, it can completely take out all of that access. And if you don't have paper records anymore, and most of the electronic medical records aren't hosted locally, they're remote hosted, all of a sudden they can be left without pertinent information. And so it's really, really becoming absolute that we have enough redundant paths that those connections, whatever they are, stay up.
Thank you. Mel, I know you mentioned broadband is a barrier, or lack of broadband, I would say, bandwidth. Other barriers in your industry, in your?
Well, if just thinking about the deaf, there's still a lot of barriers we're trying to get over, and some of that just has to do with functional equivalency, is a term we use a lot, and that is it is still new, believe it or not, to a lot of my customers to think that I can pick up a phone and order pizza. They don't understand that this video phone now allows them that affords them that type of communication. So education,
So
outreach,
right,
it's still
right.
ongoing. We're facing a time too where we do need to be very responsible. We get paid by the FCC, so we need to be very responsible with the monies that we receive and still reach everybody. But it's going to be an ongoing challenge to still have those funds, as I'm sure everybody can relate to really meet the needs of our customers on there.
Jilene, is that also a concern of yours, outreach and education? Adoption, I guess, is what I'm asking about, the adoption rate for seniors.
Yeah, absolutely. I mean, we do have a lot of seniors that are online, but we do have some that are not online, that are not comfortable, which is why senior centers have been really aggressive in advertising computer classes and around the state. There's over 100 senior centers from rural to micropolitan to metropolitan areas that, there's no fee to join. In fact, I'd love to join a senior center. They do aerobics at my speed, So that's one of the things, the barriers we have in terms of getting seniors online.
Mm-hmm. And it appears, though, that Utah is ahead of other states in terms of seniors who are adopting the brand.
Yes, that is the great
technology.
news, is that seniors are in the state of Utah, according to the Pew Research, are way ahead of the percentage of people online compared to seniors in other states, significantly.
Great. Emery, barriers. I think you talked a lot about.
As I visited the tribes, there are a lot of issues, and I've talked to Sharon about the FCC regulations. Brian kind of knows a little bit about it. And, we're talking about the older folks. In Sevier County, I think everybody thinks that this is a given. But we had, the underserved, the kids there, the Indian kids that are going to the South Sevier and Richfield high schools. The teachers just assume that they have, iPads or laptops. Sure. And my wife works under a Title VII program, it's Indian education, and it's it's real. I mean they're so far behind their cohorts that it's devastating. Then that adds to our graduation rates that are we're just far behind the rest of society.
Okay, that's a good lead-in. Can we just for a moment look at the key issues as far as deploying broadband in Indian country? So I guess you would have to have a plan to go to the tribal council, and you would need to train the users. You would have to do some outreach and education as far as telling them about all of the advantages, the economic development, preserving tribal sovereignty, distant learning, all of that.
Yes, I think within our area, there's economic development concerns, education, health,
Healthcare,
and
that's
I
right.
think the first thing that we need to do is talk to the tribal leaders and do an inventory. I look at the maps outside. What's there and what's not. I think that would be the first thing, and then start working with the providers and what they can do. They are so far behind that. Even Hinckley, Hanksville, I think they have their systems up and running. It might be slow, but it's there. But the tribal areas, they have an RV park in Cosham Reservoir, for tourism industry. They probably want wireless or, whatever needs to go. So that would be the first thing, is to meet with the tribal leaders and scope out what's there and what's not and what we can do.
Thank you. Do you have any questions? Anyone from the audience have a question? Yes?
I know a lot about what he's talking about. I live 20 miles away from Arizona, and 8 miles from Arizona, but really close to the Navajo Reservation. In Arizona, they just got $46 million, about 33 of that, I believe, was grant. And the schools and education system, when you add that with the fact that most of the kids that end up coming off the reservation into Page are English as second language learners, which is, I'm sure, something that we're having all over Utah as well, it is incredibly difficult to serve the children in the way that they should be served. And I think one thing behind getting the money, and they've got fiber basically in Arizona running all over the reservation right now, was the learning aspect. They're setting up learning centers where the kids who couldn't ever get to a school before are able to just go to the little community center and now have access to education. So I think as far as that goes, this is probably one of the biggest step forwards I've seen in the 25 years I've been down there.
Wow. So not really a question, but very, very good comments.
It affects everybody. I mean,
Right.
I've been out here advocating for Big Water today because we don't have internet except as it comes across the border from Page, and our bandwidth is maxed out. We're in a bad situation. We're on the corner of Lake Powell. There's $500 million worth of economic development driving by us every day because we can't access it. But the good parts of what's happening, not just in Utah, but nationwide, I mean, what just happened out on the Navajo Reservation is one of the most uniquely wonderful things. Just, it's been really cool to watch and to see that kids can now go, into their local, Tuba City is one of them, the school situation in Tuba City is just going to increase immensely because of what they just got.
That's
It
great.
might not happen this year because you have to have the education and the outreach, but it's going to make
Certainly,
major
yes.
changes.
Yep. Certainly a step forward.
Can
yeah.
I just say one more
Sure.
thing? There was one tribe that they're fledgling. They're not really organized yet, and the amount of dollars that they have in their coffers, they don't really know what to do with it, and it's unreal number.
I have a
Yes, sir.
question, and since we have a couple of attorneys in the room here, it'd be very quick. I actually had a telco representative tell me that the reason why they couldn't establish service in a community here in Utah that wanted to fuel their own economic development with some broadband capacity and access. He actually said to me, we can't be chasing their pennies with our dollars, okay? Now, because I have a little background in the way this works, it's like, well then, so should we go to government and see about, sweetly enticing you to do that of all the money you're making on the Wasatch Front, and now go ahead and maybe consider serving some of our underserved communities that would really like to have access so they can fuel economic development. So if you could comment about that and the way that that advocacy in terms of actual governance and law or regulation that would compel companies to go ahead and furnish services. I mean, I'm trying to understand where that works, because the gatekeeper here then is really the commercial entity, not the community. And so are we to assume then that our economic development is reliant strictly upon the desires of the commercial industry to decide what's going to happen next with our communities that don't have any access?
I think that's a great question for Sharon, since you're the broadband attorney and used to work for, I mean, I'm an elder law attorney, so that's like asking a if you want open heart surgery, it's like, I do elder law, so.
Well, I'm an elder, so that's okay.
Yeah. No, it's like if you need open heart surgery, going to podiatrist. Sharon's really the broadband expert, and she used to work for the government as well in DC. So
I spent 15 years at the FCC, and I can tell you that there is a program for serving rural areas. Based on the facts that you've given me, I don't have enough information. However, you did ask, can the government compel a telecommunications service provider or a broadband service provider to then reach out to that community? And the answer is no if it's broadband, because the government will not compel a business to do business in a place that they don't want to do business. Having said that, there are programs to encourage, and then with telecommunications, it's a little bit different. If there is a service provider who is a provider of last resort, that would be different than if it's a broadband service provider, which broadband, cable TV, they used to be considered luxuries. Well, they're not luxuries anymore. They used to be, but now with telecommunications, that's a different category, which is the two-way telephone. So they.
Full duplex. So if we had a telecommunications company that's just flat out refusing to serve a specific community here in Utah with their broadband arm, I'm just trying to understand why that can happen, and especially, I understand the part about not compelling,
right?
Not compelling commerce. I understand that part. But what I'm having trouble understanding is how the economic development of underserved communities can happen if they don't have the population. It's like a vicious circle here. If they don't have the population to get the service, they're not going to have the economic development, and they're not going to have the population because they don't have, it's quite frustrating to witness, especially if you work for the Small Business Development Center.
Oh, I don't know if that's where you work.
I did at the time.
Well, luckily in this state of Utah, their broadband is, I'm going to say, is Grant still here? Is Ben still here? Is that his name? Anyway, I believe that he will tell you that the state of Utah is 98% covered. So I guess I'm wondering about what community. What community are you talking about? So we can talk offline, but.
The good people who are trying to go into tourism development in Hanksville, for instance, they can't get Wi-Fi set up here, or at least they didn't up to several years ago when I was involved.
Well, if it's basic telephone service, it's okay.
But
Right,
You can't
so-
get DSL service to be able to set up Wi-Fi for an
Satellite?
RV park, for an RV park.
Satellite, is satellite available?
Maybe now.
Could I make a comment?
Sure.
Maybe. So, Dennis Sampson's here from the Utah Education Network, and one way it's not compelling the providers, but there have been a lot of dollars either through the FCC or grants in the last several years, and there are still programs out there that can bring some broadband through what they call anchor institutions. So if the schools get connected through these programs, it helps offset the cost. Well, it actually brings some of that fiber into the community that's easier to allow others to use it. Healthcare can do it too. And so maybe there isn't an argument, or there isn't a way, I wouldn't know, to compel them. But if we can really take advantage of some of these other programs that are out there that can bring what they call the anchor get the anchor institutions connected, it starts to bring some of those services closer. Maybe not ideal, but it's sort of a sideways way of getting there, but it is something that can be looked at.
And I think also, touching a little bit on the Universal Service Program and also Connect America, and I'm happy to talk to you about that after
Does that cover cell phones at all? Like, are they considered?
Yes, and there is a program, it's a Lifeline, and it now allows for low-income users to have a mobile device instead of the landline. And in Utah, we have a lot of users in Lifeline.
Just quickly, you asked about satellite, because I know that's something I keep running into as I've been out.
Especially in rural areas,
Beating the
remote
bushes trying to get
rural areas, right?
Remote rural areas.
Mhm.
Okay, so the problem is where we are on a border town, nobody services us. So you can get Dish Network and you can sign up through Hughes to get internet or Wild Blue or whatever. But if something goes wrong, they won't talk to you on the phone. I mean, I have 3- and 4-page dissertations from a guy that owns a bed and breakfast in Bigwater. I mean, everybody that has tried it, a construction company, a bed and breakfast, and our one little 6-space RV park, have gone back to using the cruddy service out of Page because they've been so abused by the satellite companies. They don't want to come to Bigwater. It's too far. So then they tell you to call Arizona, and of course nobody in Flagstaff is going to service you if you're in Utah. So it's...
Well, that's
the
kind of far
answers
away.
sound easy.
Right.
You know, I mean, my cat answer I've got back a lot is, we'll just use the satellite. Well, it doesn't work that way.
Just. And so as you all can see, we do have work still to do. And that was part of the theme of this workshop. I mean, we want to stay positive, but at the same time, we've got a lot going on at the federal level and state level, and we have a lot of work still to do. Yes?
I work for Centricom, and we use some of these available grants and things to bring fiber service to some of those underserved communities, most recently in Miller County. So if I specifically did not work on those grants, but I did the mapping for it. So if you want, I can give you some contact information at my company.
Great. Well, thank you, everybody. Thank you to our distinguished panelists. I see our time is up. There are some truffles by the back door. Thank you for being here and for participating.